The World Health Organization says that the Ebola outbreak in Central Africa is spreading faster and more widely than previously thought. 131 people have died and more than 500 are infected, mostly in the Democratic Republic of Congo. Cases are emerging in more towns and cities there, and the disease has also spread to neighbouring Uganda. An outbreak in West Africa in 2014 claimed more than 11,000 lives. Well, I'm joined now by Sir Peter Horby, epidemiologist and director of Pandemic Sciences Institute at Oxford University. Thanks very much for being with us. What's the latest information that we have, and how concerning is it to see this continued spread?
Thanks, Gita. It's a fast-moving situation, and what we're seeing is that it's only been, a week since it was first diagnosed. It's this particular strain of Ebola virus, Bundibugyo, and the testing of cases is accelerating, but the positivity rate is quite high. So amongst the cases, the suspected cases being tested, roughly 50–60% are testing positive, which is suggesting that actually the outbreak is quite widespread in that area. And so it's a significant concern, particularly for DRC, but also for neighbouring countries.
Are actions being taken now, even if at the start of this outbreak they weren't? Because this is a different strain to previous Ebola outbreaks, isn't it?
Yeah, I mean, it is a very challenging outbreak because it looks like it's fairly extensive from the information that's coming in. It's in a difficult place. We've seen cases in big urban settings. There's quite large populations in those areas. There's insecurity with rebel groups and fighting. There's a lot of cross-border movement. There's displaced people from the conflict. So it's a difficult place to work. And with around 500 suspected cases, you're talking potentially many thousands of contacts that need tracing in a very difficult place. So there's a huge amount of activity going on now in terms of trying to control transmission and make sure that it doesn't spread any further.
And how much can the international community help in this, as you said, very, very difficult circumstances?
Well, the first priority is, identifying as many cases as possible, getting them appropriate care and isolating them, then tracing their contacts to put them in quarantine or put them under monitoring so that we can stop the transmission. The next sort of big area is communicating with the public in the affected areas and other areas to make sure they, are fully engaged in the response, and then international coordination, because we obviously have cases already in Uganda. There's borders with other countries like South Sudan, and there's travel within the region by buses and overboard and by plane. So international coordination to make sure that everyone else is ready in case it does spread to other regions.
And what is the chance of it spreading, do you think, beyond this immediate geographic area? We've seen, obviously, wider global concerns to try to limit that.
Well, the risk to, I think, immediate neighbouring countries is high. That area of the Democratic Republic of Congo, it's a big country, but the countries bordering it on the eastern side of DRC, there's a high risk, I think, of cases crossing the border. Beyond that, the risk is low, but it's not zero, because there is, international travel obviously means that, as we saw in 2014, you can get cases flying long distances and coming into other countries. But it's not that transmissible if we're vigilant and we do the correct screening, particularly of people with fevers and illnesses from potentially affected areas. Then it's a readily containable infection.